Hello, everybody, and welcome to the Board of Supervisors candidates listening session on HIV and AIDS. We appreciate having you here, and we appreciate having all of the candidates giving up their long Friday afternoon for us.
And our first question.
The President Obama has established a nationwide goal that by 2015 that we will increase the number of Ryan White clients with permanent housing from 82% to 86%. Are you prepared to achieve the goal of bringing San Francisco into alignment and going from 9% of people with HIV having stable housing to 86% so we can stop dragging the nation?
I'd like to increase that. I'd like to increase the funding for it. I'd like to increase the number of forums, and I'd like to get the word out there. And you have my commitment today that I'll go door to door with you to get folks to come to these forums and explain to them how they can become homeowners so they don't have to worry about being evicted. Number two, again, the One Church Street development did 12 units. I get it. It's not 100. It's not 500. But there's going to be a number of developments along Market Street. And one of the things that I've thought about is trying to get those below market units, the part of the inclusionary housing piece of each one of those developments, seeing how many we can dedicate for HIV positive individuals. When we were looking for a house 5 years ago, there were no foreclosed properties in San Francisco, and now there are over 1,100 that are owned by the banks. The banks are sitting on them. They're not doing anything with them. Think about if we were able to turn 1,100 units into 1,100 units for persons with HIV. I like to talk about making them also for teachers, cops, and firefighters because I think we need to really build a middle class and a lower class in San Francisco. But those are some of the ways that I would specifically focus on as District 8's next supervisor to address the housing issue and take San Francisco off that list.
My question is for Debra Walker. Many of the youth that we work with at Bay Area Young Positives are dependent on the services of Larkin Street Youth for their housing. When they age out of those services, we are finding it tough to find housing for them. Is there plans, or do you have plans to expand the programs that would provide housing and job training to HIV-positive youth, and particularly job training such as the trades?
There's a new project going in as the first project of the Trans-Bay Terminal project that's 120 units provided by Community Housing Partnership of supportive housing with wraparound services on the ground floor to help folks become employed, to do job training. I've been working, I'm actually supported by the Labor Council, have worked really hard with most of the unions there to support their job training programs and to expand them, even the building trades, parking lots and alleys, and actually create housing opportunities, reuse adaptive reuse of the buildings that are waiting to be torn down to be developed into high rises, use them in the 10, 15-year interim, and make the kind of projects we're talking about to create really affordable housing for folks to transition.
I still remember her. And as you know, the demographic at District 10 had been changing quite rapidly, and we have more and more Asian and Pacific Islanders. So do you actually support neighborhood-based HIV services rather than culturally or ethnic-based HIV services? How do you ensure that you can support the diversity and also reduce the racial tension in that district?
There should not be such a gulf between the African American community and the API community because we have similar struggles. Access to quality health care, access to fresh fruits and vegetables. We live in the same neighborhood. Access to education. When I talk about access to have health clinics in a new shipyard development, I expect there to be a huge API community in that Hunters Point shipyard, as I expect there to be a huge African-American community in a Hunters Point shipyard. I'm going to do everything to make sure that that's a diverse project. And so that health clinic was a neighborhood-based. And when I talk about having residents in District 10 have to travel across the city, I don't just mean African Americans, I don't just mean API, I don't just mean Latino or our white brothers and sisters, I mean everyone in District 10 has to travel across the city to get the services they need, and that we need to build real capacity. I chair the budget committee at City College, and I oversee a $200 million budget. And so we're the only major public institution that does not have to lay off one single teacher or frontline worker at City College. And those are actually the same budget values that we need to be bringing to City Hall. So when you talk about prioritization, I want to prioritize frontline workers. There's no reason that this city over the last decade has increased 68% their mid-level management, while we've seen an overall decrease in our frontline workers. That means nurses. That means a lot of folks, the CNAs, the LVNs, and nurses who do the real services. So I will fight to have neighborhood-based health clinics. They hopefully are culturally competent, but the most important part is that they're in our district, and currently they're not, and I'm going to push for that.
Recently, there was a report that the CDC released about the complete correlation between poverty and HIV, which we all knew. The president in the National AIDS Strategy has asked the director of the Equal Employment Opportunity Commission to come up with some ideas on helping people living with HIV and AIDS around employment. You mentioned that in your opening remarks. Mentioning it and saying that it's important is one thing. What would you do to operationalize that?
So there are two things that I'd really like to initiate here in the city and also in this district. One is actually supporting more small businesses in the city. 60 to 70% of new jobs actually come from small businesses. And actually this past recession, actually 75% of the jobs that are lost are going to be lost permanently. That means that we need to create new industries, new jobs. Oftentimes it comes from our small businesses. So we need to figure out infrastructure to support those businesses to come into our district and also hire locally. The second area is actually supporting job training programs. This is something that I work on a bit as a Board of Education member with young people. There are year-long apprenticeship programs that have found to be most successful with working with young adults. So where you get where you're supported year-long by a community-based organization while you're doing an apprenticeship in a new industry, whether it's tech or it's banking or other areas. And you can actually partner with City College, who provides with many of these classes. An example organization is Year Up, which is here in this district. Another organization that I would love to bring to District 6 is La Cocina, which is an organization which targets immigrant women to start catering services and to open restaurants and to work in restaurants as well, which is a huge industry here in San Francisco.